Hello, my name is Kelly, and this video was created to assist those clinicians who are struggling with determining what type of orthosis to make for their patients, or you're just having a difficult time determining what type of material to use when fabricating the splint for your patients. At the end of this video, we will discuss two case studies and we'll walk through the different types of material that we discussed today and why you should choose one over the other based on the cases that are addressed. So our objectives for this video: identify four different types of orthoses and their associated indications, identify the indications and precautions associated with all orthoses discussed, understand the different types of materials along with their handling and performance characteristics, and describe key considerations that influence the decision-making process when designing an orthosis. Lastly, we're going to explain how to choose the most appropriate material required for an orthosis from the case study that we go over, and critically analyze the case provided while explaining the rationale behind the material and the orthosis that we choose. And now let's review the different types of orthoses commonly fabricated in orthopedics. So first, our static, that now is mainly referred to as an immobilization orthosis. And the purpose is to immobilize, protect, allow healing structures to continue to heal, supports unstable joints, and it's a rigid device with no moving parts. So this is the most common type of orthosis. The next three are now commonly referred to as mobilization orthoses, but I still like to describe these as dynamic, static, progressive, and serial static, just because they all have different purposes. So dynamic has moving parts, so it's a rigid device with outriggers, that's the moving part, and this is going to allow for resisted motion in the direction opposite of the line of pull. So you're trying to gain passive range of motion here. You're generating a mobilizing force on a targeted tissue. So somebody who has muscle weakness or muscle loss. Next, your static progressive. That's going to provide a low load, prolonged stretch, or you could say force at available end range. So you want to be able to reach the available end range that is tolerable for the patient, and it's a mild type of stress or force. So again, here we are trying to gain passive range of motion, and the more time that you're in this type of orthosis, the more passive range of motion that can be achieved. It also is worn in adjustments. So as motion improves, you're able to adjust the outrigger. And finally, your serial static. I think this is my favorite. I do utilize this type of splint using plaster of Paris with a lot of my patients. So here the goal is to elongate or grow soft tissue in a desired direction at its max soft tissue length. So it's a moderate stretch at end range, something again that's tolerable for the patient, and we're trying to achieve a new functional end range here. So we're promoting soft tissue elongation. This also is worn in series. So the patient comes in, you take off the serial cast, the plaster of Paris, you look at their motion that was improved, and you recast them. So you're making adjustments each week, and the patient cannot make these adjustments. Usually we're going to use this for some kind of hand or finger contracture. Now going into our types of material, the most common and the ones that I will be discussing over on the left there are polyform, easyform, sand splint, orthicast, and aquaplast. I feel like these are the most common used in outpatient orthopedics, and I definitely do use these pretty often. Some other types of material that we're going to discuss are plaster of Paris, delta cast, and aqua tubing. And I'll go in depth into a little bit into each of these here in a little bit. So first, when you are fabricating an orthosis for your patient, it's very important to understand these things called handling characteristics, which are properties when heated and fabricating the splint. So you're ready to go, the splint is ready to mold. These are the handling characteristics. So first, elasticity, the amount of stretch the material has or its resistance to stretch. So this is going to be good if you need to make adjustments when you don't have enough material, or good for those who are new to splinting, to have more of that elasticity. Drapeability, the degree to which the material conforms to the individual's hand. So this is going to be very important for comfort and to reduce any pressure areas. The longer you heat up the material, the softer it will become and the more working time you will have. So it'll become very vulnerable to stretch. Next, bonding, how well the material sticks or bonds together. So self-adherence, this could be very important when you are applying outriggers to your splint. So again, self-adherence, the material can stick to itself. Next, memory, the ability of the material to return to its original shape, form, size, and thickness. So this is going to allow the therapist to make multiple adjustments, resize, reheat the material, and remold to the patient's hand when needed. Circumferential splints need a high degree of memory, just because of, again, the nature and the property of the splint. And when you're thinking about this type of material, you need to choose for your splint. You really want to consider the degree of memory if you're going to make a lot of adjustments. Finally, working time, the amount of time the therapist has to mold or create the splint on the patient until it hardens. So there's different types of material, have different working times. For example, OrthoCast has a very short working time, so that material may not be good for novice clinicians who are new to splinting. Now going into our performance characteristics, now these are the properties that once the material is cold and it's hard, this is what we're talking about here. So the thickness of the material, pretty self-explanatory, the width of the material. The thicker the material, the more support you're going to have for that splint. So somebody with a more involved injury, you may want to use a thicker type of material. Next, we have rigidity. So the strength of the material, how much the material can resist external forces, take on repeated stress. This is going to be very important for your larger splints. So your posterior long arm, your Munster orthosis, or patients that need a splint for work, essentially. The splint can take on repeated stress over time. So that's going to be a high degree of rigidity. The finish, so the texture of the end product when it's done. Perforations, there is materials that have little holes in them. So this is going to allow for air exchange. So this is going to be good for those with fragile skin, healing wounds. You want that air exchange and oxygen to get to the skin. You don't want to stretch this type of material because if you do, the holes will become larger and it will actually decrease the strength and support of the splint. Flexibility. So this is going to be similar to elasticity, how much stress the material can handle. So taking on repeated stress, like we talked about before. And then we have two more to talk about on the next slide. So these last two performance characteristics, we have durability. So the length of the time the material will last. Over time, if you have an orthosis that somebody's been wearing for years, it's not going to be as strong as it was when you first fabricated it. So you need good or a high amount of durability for a splint for somebody with a chronic type of injury. And lastly, conformability, similar to drapeability, the ability of the material to fit immediately and contour to the area of the hand, wrist, or forearm. So if you have a high degree of conformability, you really need to be confident and good at splinting because those fingerprints are going to easily be shown and it's just going to be harder to mold. So first, let's talk about polyform. So polyform is a great type of material because it can be used for a wide variety of different injuries. So for the wrist, hand, digits, and thumb. It has great contour for small spaces, so this allows for more comfort for the patient. It's coated to allow for bonding, meaning that the material can easily adhere or stick together. Has minimum resistance to stretch, so it has the lowest resistance to stretch which isn't necessarily a bad thing, and the maximum amount of drapeability. So this is going to prevent any unwanted fingerprints, anything that's going to be noticeable on the material. This also has great rigidity and strength once the material is cold and hard. Sand splint. So I don't use this type of material a lot, but it is a great type of material for large surface areas. So for the back, lower extremity, the elbow. Also good for patients in the burn unit where you need to place their hand or the involved limb in a functional position to allow for healing. It doesn't need to remold well because of the low conformability and because of the surface area that you can cover with this type of material, but it does have some give to it. It has maximum resistance to stretch. It actually has the highest, which means it has great rigidity but low conformability. So it's able to take on repeated stresses very well. This is also good for somebody who is new to splinting because you can work with the material aggressively, and those fingerprints still won't be shown. Next, we have Aquaplast, which is also great for functional positioning. It's transparent, so when you're fabricating, it allows you to see your landmarks and any pressure areas, so you avoid those. It has 100% memory characteristics, so this is great when you need to remold, make adjustments multiple times. Maybe good for somebody needing constant revisions or adjustments due to this 100% memory characteristic. This is also good for somebody who may not be that confident with splinting, so you can easily put the material back into the splint pan, heat it up, and make adjustments. It's a good base if you're using outriggers. So if you're making a dynamic orthosis, has good stability, good bonding, it can adhere together. And there's multiple color options, which is nice for kids or somebody who may not be compliant with wearing the splint. Somebody who's paying out of pocket hundreds of dollars, they care what the color of the splint is. And it also has the second highest resistance to stretch, so it has very good drapeability. Orthicast, which is also one of my favorite types of material to use, is ideal for any finger or thumb injuries. So those small area or small surface area injuries. It forms a permanent bond when heated, so you can use hot water or hot air, and you can adjust it easily. It's very lightweight for comfort. It's breathable for fragile skin, and it has a fast application time. So although you don't have much working time, you're still able to have enough time to mold and position the joint in the desired position. It has high conformability, directly conforming to the skin, and great elasticity. It has a lot of give and stress with it, or stretch with it. And finally, we have easy form. So this is going to be ideal for patients who are non-compliant. The material can resist movement when conforming to the patient's hand or involved limb when you're trying to mold the material. So this is good for somebody maybe with spasticity, a burn, tremors, that functional positioning. Again, it does allow for some air exchange because of the perforation. So you can see those holes in the picture that allows for the skin to breathe a little bit. It has really good and high rigidity, has minimal irregularities when molding with formation. So you don't need as many details. There's no fingerprints that are going to be present. And it's uncoated, so it's going to allow for permanent bonds, so that material sticking to itself or self-adherence. All right, so now we talked about the types of splints. We talked about the different types of material and why you would choose one over the other. And now you evaluated your patient and you're trying to decide what orthosis to create and what material to use based on your patient and their needs. So first, you need to understand your diagnosis. So what is the clinical and functional problems? What is this person presenting with? What are the deficit areas? Why would this person need an orthosis in the first place? Is it to improve range of motion? Is there strength deficits? Does the person need a splint to be able to grasp and participate in daily activities? Anything like that, you need to understand what is going on, the whole picture of your patient. Next, the patient goals. So What are the patient goals? Do they need to go back to work? Do they need a splint for protection at work? Do they need a functional positioning splint? All of this kind of ties into understanding your diagnosis or looking at the whole picture. Is your patient post-operative or not? That's going to determine also what material you will need to use. You may need more support for somebody who is post-operative versus not. And then precautions. So when in doubt, have the patient in the position he or she came in. Avoid making the forearm too long or too short to avoid shearing, and avoid any positions of hyperextensions or positions that are painful or not tolerable for the patient. And of course, make sure you're padding your bony prominences and looking for fragile skin or pressure points. So next you want to consider the cost of the material. So should you custom make the splint, or should you look into prefabricated options based on whether the patient's insurance covers the splint or not? Splints can be up to a couple $100 depending on how involved the splint is. So that is definitely something that you want to take into consideration. And how much does that person actually really need that splint? Is it vital for their recovery, or is it kind of just to reduce a little bit of pain? And then also you want to think about, does your clinic have that type of material that you need? If you need sand splint for somebody who had a burn to place them in a functional hand position, do you even have that material, and how much does it cost? Types of material are increasing each year. So some places and some companies can't even afford all the different types of materials. So you want to consider that as well. How much experience do you have with this type of splint? Have you ever made a dynamic splint before with outriggers? Do you know all the appropriate materials and tools that you need? If not, you can always reach out to a mentor or a coworker for advice or assistance. And also, if you do have experience with this type of splint, if you're more confident in orthotic fabrication, you want to look for a type of material that has high conformability, like polyform. And if you're new to splinting, something with really good memory, so you can adjust it multiple times if you make mistakes, like aquaplast. Next, you want to look at the patient's activities of daily living. So this kind of ties into their goals. What is the patient doing every day? How often do they need to wear the splint? Is it just for exercise, just at night? And then the durability and rigidity of the splint. So this kind of ties into, are they post-operative or not? How much support does the orthosis require? How durable does it need to be for the individual? If it's a chronic tendonitis injury, you definitely want something that's more durable for the patient so they can wear it over time. Next, you want to consider your working time. So how many adjustments are you going to need to make? Is it an easy orthosis? You're not going to need to make many adjustments, or you're not going to make any mistakes. In this case, you would want a thinner type of material so you have less working time. Are outriggers needed? So does your material bond well to other types of material to support that outrigger and to act as a good base of support, which ties into the thickness of the material. So the durability and rigidity, like we talked about before, the thicker, the stronger it is, the thinner, the less stronger it is, and the less supportive it is. And then finally, conformability. So high conformability is a better fit, more comfortable for the patient. And this is going to be somebody who is more confident with this type of splint or making this type of splint. So the last two things you want to consider when you're choosing your type of material and the type of orthosis you're going to make, definitely the memory. So looking into the future, will you need to make a lot of adjustments? In this case, if you do, a high amount of memory is good because you can put it back in the splint pan, heat it up, and it's going to return to its original shape. And then finally, the ease of application. So this is going to increase patient compliance. Can the patient don and doff it easily? If it's too complicated, they're not going to want to take it off, or they're not going to want to put it on. Is it cosmetically pleasing? Again, people paying hundreds of dollars for their splint, they want it to look cosmetically appealing? And is it lightweight and simple? Is it, unnoticeable for the patient? Can the skin breathe a little bit? All of those things are very important and will increase patient compliance. All right, so now reiterating what we just talked about, all of those important points that we needed to think about and we discussed. Now we're going to decide which orthosis to fabricate for our patient. So we're going to evaluate the patient, obviously look at the whole clinical picture. Like we said before, look at the patient's goals and also other considerations like comorbidities. You always want to consider that, fragile skin, subluxation of any joints, past injuries, stuff like that. Then we're going to choose the appropriate material. So what's available? What is the cost of the material? We kind of already talked about that. Do you have the material at your clinic? What's the skin look like? What does the patient want to do every day? Do they need the splint for work or is it just for nighttime? What's the purpose of the splint? Why are you creating it? Is it to immobilize? Is it to improve range of motion? Why are you making the splint for this patient? And then do you have experience with this splint? So a lot of the time, especially new graduates, they don't have experience with more involved dynamic splints or serial casting. So this is also very important and something you want to consider even before the patient comes in. If you can plan ahead of time, that way you can practice or prepare. And then, you want to ask yourself some questions. So some questions that I like to ask myself when I'm deciding which orthosis to fabricate and which material to use for my patient. Did I do a thorough review of the patient's medical history? So again, did I look at the whole clinical picture, the goals, any precautions, any comorbidities? And then did I educate my patient enough? So did I explain to them why they are going to be wearing the splint, the wearing schedule? They have to wear it all day. They can't take it off. They just had a flexor tendon repair. It needs to heal. How to take it on and off, how to don and doff it, and along with the purpose. So some patients, if you do not explain all of this to them, they will take it off. They will not be compliant with wearing their splint. So this is very, very important to ask yourself. And then finally, I like to ask myself, did I check the patient's skin before they left for any red spots, any pressure points, any wounds or any skin abrasions? You always want to make sure the patient leaves safely and comfortably. And I always have check-ins with my patients. So I always tell them to call or check in within a week to make sure that everything is fitting properly. All right, so let's look at our first case example. So we have a patient status post CVA. He has high tone and is very non-compliant. He's a middle-aged male, high spasticity, like we said, and he's very self-conscious about wearing the splint that he needs. So you, the therapist, you're new to splinting, you don't have much experience, you need to make a long arm static progressive orthosis to improve his elbow extension, and you have minimal splinting material at your clinic. The goals of the splint are to reduce spasticity and to improve elbow extension for the patient. So if you take a look at the left, let's go through each type of material. So polyform. So what did we say about polyform? So it has good drapability. So it'll easily conform when not needed. So that's not necessarily good for people who are new to splinting. It'll also show those fingerprints and it's thinner. So maybe, but not the best option. Then we got aquaplast. So there's multiple color options, which that would definitely help for somebody who's not compliant. It's transparent, so we can see any pressure areas or pressure points for this person who is very spastic in flexion. And one of the most important things with aquaplast, it's very good for functional positioning. So is this something that we need to put the patient in a functional position? Maybe for the hand a little bit more, but definitely this is definitely an option for this patient. And remember, it also has great memory. So you're new to splinting, you can make as many adjustments as you need, throw it back in the splint pan, and due to that good memory quality. Sand splint. So sand splint, one of the biggest things was it's good for larger areas, larger surface areas. So yes, this is a large area. It is good for those who are new to splinting, but it won't return to its original shape. So it will lose some rigidity if remolded too many times. So this may not be the best option. It's also bad for outriggers, but we don't necessarily need any outriggers here. So the rigidity isn't that great. Then looking at easy form. So easy form is good to resist a lot of unwanted motion. So it has that maximum resistance to stretch, but it has poor memory. So it's not going to return to its original shape. So again, this isn't great for those who are new to splinting, because you're going to probably have to make a decent amount of adjustments for this patient to make sure that they're in the position that you want them to be in. And then finally, OrthiCast. So OrthiCast is super thin, so may not be the best for somebody who we're trying to put in a elbow extension position. If it's too thin, then it's not going to be very supportive, so you'll need multiple layers. It does have different colors, which is good for people who are non-compliant. But remember, OrthiCast is better for smaller surface areas, so like the thumb, the finger, stuff like that. So having said all of that, Aquaplast would be your best option. Again, multiple color options for that non-compliant patient. You can use a transparent Aquaplast material to look at pressure points. It's good for functional positioning. It also has a long working time. I don't know if I said that. And then that great amount of memory where you can make as many adjustments as you need. So Aquaplast is the winner here. All right. Now our second case example, we have somebody status post proximal humerus fracture, and she ended up having a radial nerve injury as well. So this is an older female. She has wrist drop. Her proximal humerus fracture was 2 months ago, and she has very fragile skin. You, the therapist, are very confident with your splinting abilities, and you need to make a dynamic orthosis for the hand with outriggers to put those digits into extension so the patient is able to functionally use the hand again. So the goals: improve wrist and digit extension, and like I just said, to be able to functionally use the hand. So that is your goal here. So going through the materials, so let's start with polyform. So polyform, remember, is good for circumferential splints and people who are confident with splinting. So those are two things that are on our side. It has a high amount of conformability, so that's going to be good for more comfort for the patient. So this person has fragile skin, so you want to make sure it's comfortable. It's not going to return to its original shape, which is okay here because you're a more experienced splinter. And it's very, very good for a base for outriggers. So that's something we need. We need outriggers for digit extension. And it has a high amount of rigidity. So again, this person is going to be wearing this all the time. They're going to want the splint to have a lot of support, have good strength, so that high amount of rigidity. So polyform so far looks pretty good. Then going into Aquaplast. So the patient wants to be able to take the splint on and off easily. It's circumferential, but Aquaplast is kind of thick, so it's a little too hard for them to take off. It can be thin, but in this case, we're going to say that it's a little bit thicker, the Aquaplast that you have. It lacks rigidity, so it's not going to be the best option for outriggers, and it's better for somebody who's new to splinting. So not a bad option, but it's definitely not above polyform. Sand splint, so it's better for larger areas, which this isn't necessarily a large surface area, and it also resists bonding to itself. So again, that's not great for outriggers when you need that self-adhesive property. And with this dynamic splint, you're going to want more fine details, which sand splint doesn't really relay that. You're not going to see more fine details. Next, we have easy form. So easy form has a maximum resistance to stretch. Okay, and then it bonds to itself easily, which is good for outriggers. So it could be an option. It has good rigidity. It doesn't have, the highest amount of rigidity like polyform does, but it's definitely an option. And then finally, Orphi um, right away you should be thinking, no, it's too thin. It's okay for outriggers, but it's not going to be as supportive, and that's the key. You really need the splint to have a lot of strength, a lot of rigidity, a lot of support. Um, and when you can compare it to the other types of material, it definitely doesn't win in that category. So again, it could be an option, but here you're determining what is your best option for this patient. What is the best type of material? So having said all that, polyform's the winner. So again, great strength, high rigidity. It bonds to itself. It's a good base for outriggers. Um, it's better for those confident splinters, and it has a high amount of conformability. So looking at all 5 of these, that would be your best option. Thank you so much for watching. I really, really hope this helped you understand the way you should be looking at your patient and in determining what orthosis to make and what material to choose. I hope that this clarifies a few things. If it doesn't, or if there's something that we didn't discuss that you have a question about, please comment on this YouTube video, or you can message me on Instagram at @splinting101. Also, too, as most of you know, I recently created a introduction to orthotic fabrication pocket guide. So it's an easy on-hand little resource on how to make different splints. So check that out with the QR code right there on Etsy. Thank you so much.